Thank you, Mohsin. Thank you for this introduction. And hi, everyone. Thank you for being here once again. I wanted to also thank you, CBAM, for supporting us throughout all these years and our beautiful collaboration. This webinar is presented by Alphascience and our group, the Daniele Henkel Group. Our company has been founded in 1997, for those who don't know us. Our group has been supporting the growth of clinics for decades, introducing advanced skincare and technologies in the medical aesthetic field, as well as a broader medical application such as pre-post-op, phlebology, post-breast cancer management, plastic surgery, and more. Just a little intro. Through the different divisions, we're deeply committed to advancing longevity, women's health, wellness, and aesthetic medicine with a strong focus on multidisciplinary approach. What we're sharing with you this evening is just one segment of a much broader transformation happening in our industry. Melasma is one big deal, and you'll discover today how we can achieve that. Over the coming months, we will be introducing several key initiatives designed to elevate not only the clinical outcome, but also everything in a clinic, from positioning, integrating regenerative medicine, and longevity, which is really a big topic nowadays. If you'd like to stay connected to everything we're building, my team, I think, has shared a link in the chat. I encourage you to subscribe to the webinar, to the newsletter for more insights. Without further ado, it's my pleasure to introduce our two exceptional panelists. And you're right, Mohsin, we have two amazing, knowledgeable women with us. First, Dr. Renita Ahluwalia, a Canadian board-certified dermatologist specializing in both medical and cosmetic dermatology. She's the co-founder of the Canadian Dermatology Centre, which rapidly became one of the largest in the country and is now part of the Canadian Plastic Surgery Centre. She also founded the Canadian Research Centre, recognized for its leadership in ethical and high-quality clinical trials. With over a decade of experience, her approach is rooted in personalized 360-degree vision for patient care. Hello, Dr. Renita, and welcome with us. Joining us as well, Dr. Gladys Paguaga from Mexico, a dermatologist and skin cancer surgeon with over 15 years of clinical experience. She has been practicing dermatology since 2013 and holds a master's degree in aesthetic dermatology. Gladys, you're the founder of Better Skin Advanced Dermatology and Aesthetic Clinic in Mexico City, and you have been working with Alphascience for over 6 years now. You're deeply committed to science-based practice, and you're known for integrating advanced dermatological solutions to optimize both clinical outcome and patient satisfaction. Thank you, Gladys. I would also take a minute to thank Alphascience team from Paris headquarters for joining us tonight despite the time difference. Merci beaucoup. And now let's dive into today's topic, melasma, and how we can truly begin to address it with effectiveness. I encourage you also to stay till the end, as we will be walking you through the next steps, how to translate what you will learn today into your practice, and how to continue building with us moving forward. Should you have any questions, please do not hesitate to write them in the chat, and we will proceed with the Q&A at the end of this webinar. Pour les francophones parmi nous, n'hésitez pas à écrire vos questions en français. Let's begin. Dr. Gladys, the floor is yours.
Good evening, everyone. I'm delighted to be collaborating tonight with Daniele Henkel Group by sharing with you my experience with Alphascience. So we are going to start with the next, please, slide. Can we go to the first slide of my presentation, please?
Yes.
So let me tell you about Alphascience. Alphascience is a French medical-grade skincare brand recognized for mastering the science of antioxidant intelligence, targeting aging signs and hyperpigmentation. Alphascience is a benchmark in medical antioxidant innovation through advanced science-backed formulations. 35 years of expertise in antioxidant science, supported by over 50 clinical studies worldwide. Also, patented technologies. Alphascience brings patented technologies in antioxidant science to clinical practice with more than 7 international patents, high stability, proven bioavailability, and unique combinations. And also, Alphascience is designed to optimize medi-aesthetic procedure such as lasers, peelings, microneedlings, radiofrequency, IPL, regulating oxidative stress to limit pigmentary rebound, erythema, and impaired regeneration. And of course, at home, use maximizes and sustains treatment results. Next slide, please. So, what makes Alphascience so unique? Because it is an antioxidant specialist, of course. Antioxidants, can be fragile and volatile. Alphascience has overcome that challenge by harnessing the power of potent yet fragile antioxidants to develop high efficacy and high tolerance formulas across all phototypes through its exclusive next gen stabilization technology that we're talking about soon. Alphascience is also a pigmentation expert. They offer unique and innovative solutions for this complex multifactorial concern, which affects a growing number of people around the world. Alphascience is also a trusted medical partner who work with us professionals to support an extensive range of medi-aesthetic procedures. So, Alphascience is a condition-oriented brand. We say its core focus is to bring condition-oriented solutions. Alphascience targets the root causes of skin issues rather than just symptoms. Their products are formulated to address melasma and dark spots with Melabright, pigmentation and dull complexion with Alpha Bright, wrinkles and vascular fragility with Tannic, radiance and sebum revelation with Phytic, dehydration and loss of plumpness with HA Booster, and uneven texture and resurfacing with Alpha Night Peel. And that's not all. It also treats dark circles and puffiness with eye matrix, firming face and neck with Ultra Firm, wrinkle smoothing with Surface, and post-procedure irritation with Regen. I love also skin lace that I have in Mexico and I use in my patients after hair removal laser. These all treatments are medical grade skincares with high concentration, optimized pH levels, and excellent skin tolerance. And I use the complete line with my patients. And now, coming soon, the newest addition to the family that I'm dying to try soon, Nova Cell, the Longevity Serum. This is a unique multi-level rejuvenating serum that will increase firmness, density, radiance, and resilience. The ingredients are 4% epigallocatechin gallate, that is EGCG, the first patented stabilized green tea catechin. And that's not all. 8% ascorbic acid, 7.5 ginkgo biloba extract, and 2.5 glutamine. So now, who's presenting? Dr. Renita.
Thank you. Thank you for the introduction earlier, Linda, and for the lovely introduction to the line. I'm actually new myself to Alphascience, so I found it to be a really manageable line with products that you can really understand. And I've had a chance to use a few of them, and I'm liking the results. I'm a dermatologist. My practice is in Toronto. If you have any questions, you can reach out to me through Instagram is probably easiest, and my handle's over here. This is our office, Canadian Plastic Surgery Center. It's Don Mills and York Mills. So one of the things that I see a lot of in my practice is pigmentation disorders. And these are pigmentation disorders of all kinds. And people can be coming in asking for different treatments, facial rejuvenation. But if their skin quality doesn't look good, if they have pigmentation on their skin, that end result is not going to be where we want it to be. So that, is the cornerstone of my practice, is that 360 result for each individual patient and looking at the skin quality. And now more than ever, even skin tone, skin quality, hydrated skin tone is so important. People are having pictures of people with filters saying that they want their skin to look like that. So, there's lots of pressure there, and there's a huge psychosocial impact of those dynamics. So having to educate our patients about this and what we can achieve and what we cannot achieve is important. And so for pigmentation, we have a lot of in-office procedures like lasers and microneedling, but there's such a need for excellent skincare because I can clear their pigmentation, but if the homework is not there, they're not going to get those sustained results. And it's also important to consider cultural considerations in these areas, right? Acknowledging cultural beauty norms and, addressing sometimes that elephant in the room that, no, we don't want to bleach your skin, but we want to recover a uniform skin tone that is healthy for you. So one of the hardest forms of that type of pigmentation to treat, and the focus of tonight's webinar, is melasma. So, before we can treat melasma and learn about innovations in melasma, we have to understand what melasma is. And so melasma is a chronic condition. And I think that's the key word, is that it is chronic. It's an acquired hyperpigmentation. And what you tend to get are these geographic type plaques that are brownish or grayish. And they predominantly happen in sun-exposed areas, often the cheeks, the forehead, the upper lip. And there's two main factors involved. And that is hormones and sun exposure. It's more prevalent in pigmented phenotypes. So it's mainly the 3, 4s, and 5s. And people who've had a family history and people who are on hormonal treatments or going through hormonal changes. And when they are exposed to UV light and also visible light, and there's some debate too about heat sources, that causes oxidative stress to the skin. And that leads to inflammation, and that leads to production of melanin in an irregular format. And it's a very complicated process. So the way we treat it, there have been some recent consensus papers. There was one recently published in 2025 in the European Journal. And the cornerstone of the treatment is sun protection, and not just any sun protection. I think patients with melasma need to be using a mineral tinted SPF. And the reason for that is the tints, which are made of iron oxide, block visible light, which is very important. The triple combination therapy referenced in the paper is the traditional treatment for melasma, and that combines hydroquinone in a varying percentage with a retinoid of some form and a steroid of some form. And although it can be quite effective, it's not something that you want to do long-term for your skin. So usually when I use these combinations for my patients, I only have them use them for 2 months. I have to be really aware of the percentage of hydroquinone that they're using to minimize their risk of developing exogenous ochronosis, which can cause increased pigmentation in their skin. Some people try hydroquinone monotherapy in short cycles as well too. And then you need your maintenance therapy. So there are a lot of different things on the market, non-hydroquinone-based tyrosinase inhibitors and agents like that help to modulate melanogenesis. And maintenance can also involve cycling on and off hydroquinone, although we're trying to do less of that. Systemic therapy with oral tranexamic acid has gained popularity in recent times, but I don't like to keep my patients on it long-term, and most of my patients do want to come off of it at some point. So they do get good results when they're on it, but maintaining those when they're off is important with skincare. And then, of course, we have procedures in our office. There's different peels that we can use and different lasers like pico lasers, Q-switched lasers. You can even use, for certain types of melasma, you can even use a vascular laser if there's an underlying vascular component. And then there's microneedling with different agents like topical tranexamic acid is something we sometimes try, or different solutions like PDRN with vitamins, amino acids, minerals. So there's a lot of different things that we're trying, but it's a challenge. And having that combination that you're going to need to do that first line, that skincare, that's non-negotiable, have your maintenance therapy and use procedures as needed. Having that discussion up front really sets expectations for patients. So let's talk a little bit about those complicated pathways. So one, you get all this crosstalk between the keratinocytes, those skin cells. And then you have the other types of cells that are involved as well too, like your melanocytes, and they're dendritic cells, which pass the pigment to the keratinocytes. And then you have all your inflammatory cells that are producing agents too. So when these cells are communicating abnormally, you're amplifying the pigment production. So we want to regulate that. Then, of course, limiting reactive oxygen species and photoaging damage. So oxidative stress intensifies these signals. So we want to use good antioxidant protection so we can help to restabilize the skin and limit that damage. And then that chronic low-grade inflammation that's stimulating those melanocytes and sustaining the melasma needs to be under control too. So there's lots of different areas that you need to target in the different layers of the skin. So let's look at the keratinocytes. So keratinocytes, those are the skin cells, and they release pro-pigment mediators. And what that does is it makes those melanocytes, it makes them produce more pigment, and they have these little dendritic tips that pass the pigment to the keratinocytes. And when they're stimulated like that, you get more stimulation occurring, even if a patient is being very good and not actively in the sun. They also have a stress response, and that causes more activation of those reactive oxygen species and signals inflammatory signaling. So melasma patients often notice increased sensitivity to light and heat, and they have a lot of just daily triggers. Some patients, even cooking in the kitchen, they notice flares of their melasma because of those heat sources. And then because of this inflammation and irritation, you get skin barrier dysfunction. So normally our skin barrier is like this. When you have a dysfunction of that skin barrier, it leaves it like this, making it more susceptible to irritants like pollution, like light. And then what do you get? You get more reactive oxygen species production. Those keratinocytes get stimulated again, and that cycle of pigmentation and inflammation continues. And at the dermal level, we have a bunch of cells that are involved. The fibroblasts that cause more inflammation, the mast cells, and of course, even deeper down, that basement membrane disruption, where you're actually getting matrix metalloproteinase mediated collagen destruction. And that causes some of the melanocytes to even drop down deeper into the dermis. And that causes that dermal melasma, which is very tricky to treat. It's more persistent, more treatment resistant. And often patients have components of both, and being able to target both with different mechanisms is important. And the vascular factors, there's been some interesting publications on this too, and I've seen it clinically, and we've been able to treat it well too. Some patients have a really higher increased vessel density with melasma, and that's likely because of the impact of VEGF here. And that causes that increase on the melanocyte dendricity, and you get nitric oxide production, and that all leads to microvascular dysfunction and inflammation. And so some patients, actually, you can look with a dermatoscope, or sometimes you can see there's a lot of redness behind the brown, or sometimes it even just looks pinkish in certain skin types, and in some skin types you can see those blood vessels underneath. And in those patients, sometimes treating it with a more vascular approach, sometimes using a vascular laser, can be actually very beneficial. So I think what makes melasma one of the most challenging conditions we treat is because it is multifactorial, and it does want to come back because of that residual inflammation. I think it's important to understand all those factors so we can treat it well. So you have a higher sensitivity to inflammation. The pigment is in the epidermis and the dermis. There's all these vascular and inflammatory components, and it's something that keeps coming back. When I see a patient with melasma, I tell them, I can make you much better. And if I could keep you in a bubble forever, you would maybe stay that way. But there's a lot of homework that needs to be done. And we're going to get to know each other quite well, because I will need to keep seeing you because it is a chronic condition. So melasma and pigmentation. So skin reactivity is a big part of this puzzle. So controlling the oxidative stress and the inflammation is an important take-home point. And again, we talked about the barrier dysfunction, that low-grade inflammation, the dysregulation of melanocytes. So before we do anything, we need to take these considerations into mind. And before, patients come, they want treatments, they want their problem solved. But if they're not doing the homework, if the skincare isn't perfect, if they're not wearing sunscreen, if they're not using an antioxidant, then there's no point in doing any in-office procedures. There's no point in them spending the money because they're not going to get the results they want. And especially in darker skin types, if I want to use energy-based devices at the fluences I want to use them at, skin conditioning is an important part of what I tell my patients. So how do we create a safer path to long-term pigmentation control? We don't want treatments that are going to disrupt our skin barrier further. And it requires more than just one solution. So we want to condition the skin to reduce inflammation, to stabilize melanocyte activity, to improve our skin barrier, not disrupt it. The way a lot of products work that are targeting pigment is sometimes by irritation. And so we don't want that. We want to improve treatment tolerance, and we want to support what we're doing in office. And that's where cosmeceuticals come in. And we want formulas that are backed by science. And if we can target these different mechanisms of action that are all in interplay in melasma with a consistent routine or products that specifically do this, we're going to get better outcomes for our patients. So antioxidants have a really important role to play. We know that antioxidants neutralize free radicals from the environment. They improve, they've actually done studies to show in certain cases how they improve the minimal erythema dose. So they actually prevent patients from burning as much as they did before. And we have seen that antioxidants, particularly vitamin C, as a reliable pigment improvement source. And we know that they're very safe in patients who do have melasma. And now they're recognized to have different biological pathways beyond just, neutralizing free radicals. For some of them, in the correct formulations, they can even be involved in direct pigment regulation, and that they can act at different levels, the epidermis, the dermis, the vascular level, to influence the microenvironment that we talked about that drives melasma. So let's leverage some of those antioxidant properties. I really like this slide because it shows us you have your direct melanogenesis inhibitors. So we know that in the skin, tyrosinase is one of the enzymes that really helps to produce pigment, as well as dopaquinone. It's one of the first unstable reactive mediators in the melanin synthesis pathway, and melanin polymerization. So antioxidants and treatments that we can target in that factor are the cysteamine, the L-ascorbic acid, the glutathione, and resveratrol. For epidermal and dermal layer regulators, oxidative stress, matrix metalloproteinases, inflammation, SIRT1, again, your vitamin C, resveratrol, niacinamide, silybilin are all different ways that we can regulate that. And for vascular, so those endothelial reactive oxygen species to support the microcircular vasculation and decrease inflammation, we know tranexamic acid, ginkgo, again, vitamin C, resveratrol, and silybilin as well. So if we can have a formula that contains a lot of these ingredients targeting the melanogenesis, the epidermal factors, and the vascular factors, we're going to be able to support our patients with melasma to get better outcomes.
So hi now again. So let's start with a brief history of cysteamine. So cysteamine was first recognized in 1950s as a therapeutic agent for cystinosis, that is a rare lysosomal disorder. In the 1960s, it was brought as an unexpected finding that they saw that the first clinical observation of cystamine's ability to reduce skin pigmentation. It was in 1990 that it was approved for cystinosis in the US in 1994. From 1990 to 2015, cysteamine achieved FDA approval and also was integrated mainly for treating other systemic pathologies. The important moment of cysteamine potential in dermatology came in 2015 when Susan Farshid published evidence of cystamine's depigmenting effect in the British Journal of Dermatology. This study confirmed the interest in topical formulations for the treatment of hyperpigmented disorders. Since 2020, many studies have validated topical cysteamine as an effective alternative to hydroquinone. Research have demonstrated comparable efficacy with improved tolerance. The breakthrough came in 2025 when cysteamine was included for the first time in the global consensus at the EADV on the management of melanin hyperpigmentation disorders. So let me show you the elegant simplicity of cysteamine. This is a very small molecule. Its formula is C2H7 and S. And you can picture a short chain. At one end, you have a thiol group that is sulfur and bonded to hydrogen. And on the other end, you have an amine group that is nitrogen with two hydrogens. These two groups are connected by only two carbon atoms to create an aminothiol. The thiol group, it's a powerful antioxidant. The amino group helps the molecule penetrate the skin cells, and it can easily pass through the skin barrier. So there's some key facts about cysteamine. Next slide, please. Cysteamine is naturally present in our bodies. It is produced in every human cell, and it is a byproduct of the degradation of coenzyme A during nutrient metabolization. It's non-toxic and non-mutagenic, but it also is a protector. Cysteamine is one of the nature's antioxidants. It neutralizes free radicals. It protects cell membranes from oxidative damage. It helps maintain the balance between oxidation and reduction in our tissues. And it also acts as a cellular cleaner too. In lysosomes, cysteamine helps break down accumulated materials. This is why it works in cystinosis. So therefore, it's a redox active thiol regulator essential to cellular health. Cysteamine has many mechanisms as it works as a depigmenting agent. Tyrosinase inhibition, it's very important. And this is because tyrosinase has copper in its active area. And what cysteamine do is that it chelates this copper. But cysteamine doesn't stop here. Some tyrosinase that still work converts tyrosinase to dopaquinone. Here's where cysteamine thiol group becomes crucial. it captures the dopamine directly. Think of it as intercepting the pigment before it forms. The before slide, please. Then there is peroxidase. This enzyme also contributes to melanin synthesis. Cysteamine inhibits peroxidase 2. Cysteamine also acts as the glutathione levels due to the analogy between cysteamine and glutathione. Can we go back, please? One more. Back. Yes, there. So the next one. Yes. Cysteamine also acts at the glutathione levels due to the analogy between cysteamine and glutathione. Cysteamine also offers antioxidant effects by scavenging the radicals that stimulate melanocytes. Less oxidative stress means less pigment production. So one single molecule for a multi-pathway depigmenting action. Next slide. On this diagram, we can see how cysteamine acts on multiple levels or targets of cysteamine and on melanogenesis. Enzyme inhibition, peroxidase inhibition, glutathione modulation, and antioxidant protection. Next slide, please. So yes, there are some challenges and some drawbacks. Cysteamine, we know it's a highly reactive molecule. It oxidizes rapidly, highly sensitive to air. We know that when it has contact with air, it turns into cysteamine, that it's the ineffective form. So there's need for a protective system in the formula. And another drawback is the smell. Due to the sulfur group in cysteamine, the molecule presents an unpleasant odor. This was another formulation challenge, which has led other formulas until now to be rinsed off, contrary to what we have now with Melabrite. This is why Alphascience have developed a formula to solve these two problems. Next. Alphascience has developed a unique strategy to stabilize fragile antioxidants through its next-gen technology. It is a modulation of ion exchanges between antioxidants, and with this technology, antioxidants stay stable, even in water-based formulas. Cysteamine, a potent antioxidant, is now stabilized with thanks to this technology. The proof of stability. This stability has been measured over time, over 6 months, and confirmed by the absence of cysteamine, the degradation product of cysteamine in the formula. You can see here that Melabrite has cysteamine, 3% cysteamine, and at 6 months, you have almost the same concentration. And there is no cysteamine in it overall. So this make us sure that there is a stability throughout the 6 months of the product. So this one slide, it's very important to me because I know many love hydroquinone and has been like the keystone treatment after obviously the use of sunscreen. But I would like to show you why you should be using more cysteamine and maybe less hydroquinone. And talking about the mechanism, we know that cysteamine is non-toxic and it preserves the cell function. And that is very important when you treat melasma. And hydroquinone is cytotoxic. So you can induce melanocyte death. In long-term use, you can't use hydroquinone because you have also many risks to have achronosis. So you require drug holidays. And you can't use it as a maintenance treatment. So you have Cystamin or Melabrite that is suitable for continuous use. In side effects, we know that Cystamin, it has a highly safety profile. When the side effects of hydroquinone are very known, the risk of achronosis, rebound, many patients have irritation, and many patients even get worse when using hydroquinone. And when we think about the philosophy, we know that treating melasma, it's very complex because melasma has a complex pathogenesis. So just treating or doing a suppression of the melanocytes, it is not going to work as well as Cystamin that works in the whole environment, nurturing the soil. So that's why I don't personally use too much hydroquinone. I can say that in the last 4 to 5 years, I haven't used hydroquinone in the face of my patients. So we had this comparison between melasma and hydroquinone. And this is important to have because I know that many people think that hydroquinone is more effective than melabrite. But you can see in this study that the comparative efficacy of Cystamin is much as hydroquinone, and hydroquinone at 4%, and have also or better tolerance than hydroquinone. I read this article, and the patients that use hydroquinone have sometimes to stop the treatment because they get irritations, and the group of the patients that use melabrite didn't. So that's always, of course, something good. Next slide. So overcoming formulation challenges was one thing, but ensuring the product will be extremely easy to use was also key. Unlike others, rinse of creams, Alphascience Cystamin formula comes as a serum. It's enabling layering also. And it's a simple serum that can be applied in seconds. It can be left on the skin. You don't have to rinse it out. And it's easy to integrate your patient's daily routines. It has high tolerance, and this is because it's exceptional pH that is 3.8, similar to the skin. And the synergy of antioxidants self-stabilize the formula. So there is no need for added preservatives and no need for potential irritating and added fragrance either. It is therefore an innovative and safe option for a hyperpigmentation requiring long-term treatment approaches and can be combined with in-office procedures that we do, like lasers, microneedling, and peelings. So this is melabrite's formulation. The active ingredients are 8% ascorbic acid, 10% ginkgo biloba concentrate, 3% cysteamine, 1% phytic acid, and acetylglycyl beta-alanine. Next slide. So now we have that Alphabrite melabrite, it's widely considered a perfect illustration of antioxidant synergy, specifically designed to address stubborn pigmentation. You can also use it in post-inflammatory hyperpigmentation, melasma, of course, and skin aging. It acts at multiple levels of the pigmentation process, and that's why it is so good. By combining highly concentrated antioxidants that work together to stabilize, enhance, and protect. Key antioxidant synergies are between cysteamine, that we know is 3%, it's stable and works as a powerful antioxidant that inhibits both the tyrosinase enzyme and also peroxidase, while reducing free radicals. It also has ascorbic acid, I said 8%, that its ability, it's very important to block melanin transfer and increase epidermal renewal. 5% phytic acid, that also works as an antioxidant scavenger that reduces lipid peroxidation and controls excess of melanin. And we have ginkgo biloba, a potent antioxidant and vascular protector, particularly useful for skin exposed to pollution and environmental stress. So here we have this formula that it's very complete, that work very well together, that was produced based on science, and that will help you with your patients with stubborn hyperpigmentation. Rather than targeting a single pathway, such as melanogenesis, Melabrite aims to optimize the overall skin environment. And as we know, that is very important. And as Dr. Renita explained, melasma is very complex. So this is beautiful working with us and our patient. So now we're going to do the understanding of melasma key takeaways that are, next slide, please. Not just a melasma is not just a melanocyte chronic disorder. It's a complex interaction between epidermal, dermal, and vascular mechanism. Treatment must go beyond big pigment suppression. We know that hydroquinone at itself, it's not working in every patient, and we need more options like Melabrite. There's a necessity to take the microenvironment into account. And topical antioxidant combinations, namely integrating cysteamine, offer a comprehensive solution for treatment efficacy.
Okay, so now we understand the product line, but I guess the proof is really in the pictures. So I have some nice before and after pictures from users from across the world to share with you, and their combination therapy ones. And then Gigi has a whole collection of her very impressive photos to share too. So I'll go through them pretty quickly in the interest of time so we can stay on time. Okay, so this is a patient from a doctor in Paris, and they used Melabrite daily with SPF 50 and also had some microneedling treatments, low depth with TCA, interesting, with hydrogen peroxide and kojic acid. And this is her 3-month follow-up. And you can see a nice improvement in both patients shown here. This is another patient who combined the Melabrite with SPF 50, just one chemical peel, details not given, but a very nice result and a sustained result. And I think this is where the importance can really be showcased, is this is 12 months later, right? So that's the importance of continuing the Melabrite and the SPF 50. And here, we do a lot of laser treatments in our office. So it's nice to see those results combined with Q-switch laser and with Pico laser. One example from Greece and one from Dr. Pam in Canada. Short follow-up, but really nice results. And this one is from Japan. So low fluence 1064, almost like a laser genesis, it looks like, to the whole face with Melabrite and daily SPF 50. So impressive result again. And another one from Japan, that same protocol, a 3-month follow-up, very impressive results. You can almost see how those pigment clusters get broken down. This looks like a combination of melasma and solar lentiginase. And you can see the lentiginase were circled, and they were lighter at 1 month and almost gone at 4 months and pretty much completely resolved by 14 months. And the patient did only 2 sessions of laser and continued with their skincare. So very nice
We can
results.
also see a change in the skin texture, the quality, the health, the skin health is also,
Totally.
yeah, the
Yeah,
wrinkles.
and I think it's also one of the things you told me, Linda, too, and what we've observed. It's you can use it in other types of pigmentation too, because those 2 spots on her cheeks are melasma. So that's important to know too. And then there's also,
Sorry, Renita, I personally don't have melasma, but that's the only serum I use with everything else in the brand because it just changes your skin texture, quality, wrinkles, and I am every little thing I'm gonna have on my skin is gonna stay. I'm gonna have a mark because of my phototype, right? A little pimple is gonna stay for 6 months, and with the product, it really works well to even prevent those marks from staying, which I love it. I don't. There's another product that we have, which is the Alpha Bright for pigmentation that I started using in the beginning, and I switched right away to the Melabright, although I don't have melasma.
yeah, and that was interesting. That was a question I was asking you too. Like this formulation, because of the combination of antioxidants, can target solar lentiginase. It can target post-inflammatory pigmentation, and most patients with melasma also get those types of issues too. And certainly, everyone has their own pigment issues. This was nice to see. You can see a lot of underlying redness. This was done with some kind of Visia scan. So you see the redness parameter and how much it was improved 2 months later. And even in the standard photo, that flushing, that redness, that vascularity is almost completely resolved clinically. And then again, this is a Visia type scanner, and you can really see how the pigment gets broken down. And even that pigment that you can't quite see on the skin, you can see in the scan, and that has been broken down quite effectively. And so this is a patient who was on a high dose of oral tranexamic acid, plus the Melabright and SPF 50.
We can't hear you, Gladys. You're on mute. So these are your pictures, yes.
Perfect. Yes. So Melabright is very effective when used alone. So I wanted to show you these pictures. This it's a beautiful result with Melabright used twice daily and obviously SPF. And you can see it's phototype 3 to 4. It's a Mexican patient. It's not mine. You're going to see my results in a few. But we can see that this is just a month apart, the before and after. So yes, Melabright works wonderfully with just alone, being alone, with SPF, of course. So the next slide, we can see another beautiful case with results with follow-up in 2 months, where we can see the change in the skin. I personally have 2 years experience using Melabright with my patients, and I'm very happy because it just like not only what you said, Linda, clear the skin or correct the hyperpigmentation, the skin quality overall is improved, and you can see it in this patient. And this is like very a very good thing to see because patients love the result. And I have in the next slide a patient of mine that she was having much trouble with her melasma, dealing it for years. She owns a spa and she have done or tried everything you think about. Lasers, she did microneedling, she had everything, you name it, she had done it. And she is the wife of a friend of mine that is a plastic surgeon. So I have the challenge that I had to do good with her. So when she came, I know that she's a multi-treated patient. So these patients are very difficult and not for Melabright. You can see here the difference. This is a 3-month follow-up. And you can see how her skin is luminous, her skin looks hydrated. Of course, she still has a bit of pigmentation, but most of it is gone. So these pictures are very lovely. I have another patient. Please, next slide. This patient came from Cancun. In Cancun, that you're invited if you want to visit Mexico. In Cancun, there's a lot of sun, of course. It's very, it's in the beach. So many have melasma over there and they get worse in summer. So this patient was going to get married and she needed to look good. So something I say is that I love having a diplomatic approach to treat melasma because I'm very careful not to irritate the skin. I'm taking all the pigment away without the melanocyte even noticing. And that's what happened with Melabrite. This patient was very happy using Melabrite twice a day and, of course, her SPF. She had been using hydroquinone for many years on and off, but she was getting irritated every time. With Melabrite, you're not going to have that irritation because it has a very safe profile. On the next case, we have another beautiful result. You can see the overall improvement. We have here the photos at 6 weeks where you can see the difference. Still, of course, a bit of redness, a bit of pigmentation, but you can see the improvement in her luminosity, more even skin, and healthy looking skin. And in the next slide, you can see the pigment is gone. And this is at 3 months. So this patient was very happy. She's from Chile. She was new in town and she was looking for something new also in her treatment for melasma because she had tried everything.
It's beautiful. The light, the skin, the brightness, it's an overall, and that's what I usually say to clients when they speak to me and they wonder, okay, but which one is for wrinkles? But which one is for pigment? And which serum do I use for? And I'm like, this is the beauty about this product. You choose the Melabrite for pigment, for melasma, you have it all. It will improve the skin quality. And on this picture, it just summarizes everything we say.
Yes,
Very
love
nice.
it.
Very nice.
And
Beautiful pictures.
And on the next slide, I have this patient that was 29 years old. But if you see her pictures, her first pictures on the left, she looked older because of her severe melasma. And it was something that was making her confidence go down. She was feeling very bad. And she almost was crying the day she came because she was telling me that she was feeling very bad about herself. I asked her what was her previous treatment. She has used everything you can think about it, everything over the counter. And of course, it was important for me to help her. You can see here a before and after. Use Melabrite twice daily with SPF. This after is at 3 months. And she was very happy with the results. I saw her a month ago, and she has a boyfriend right now. So she's very happy. Melabrite has changed her life. She's very bubbly, she's very happy, she's in love, and she looks good, really good.
That's
So
what we
this is
do.
what I
We
love.
impact people's in many ways, and every,
Yes.
maybe for somebody it doesn't mean much, but for some others it means a lot. It's like wearing a
Yes.
mask for them. Yes. Yeah.
I love Melabrite. Yes.
I mean, those before and afters were the most impressive because they were monotherapy with sunscreen. So that's very exciting. There was a question in the chat about how long it takes to start seeing results. And I noticed with like just texture and tone from using the product, you see that pretty quickly. But for pigment, what would you guys say?
6 weeks.
That's quick.
Yes, very quick.
Okay. So you know who I am now. So next slide. So patient compliance is is really important in melasma. And so a simple skincare routine that can meet the requirements to support everything else we're doing, or in many cases, that is the only thing they're doing with these products, and the results look really great, is very important. So, even with the examples of your patients that you gave, and we see this every day in our office, melasma has a huge impact on the quality of life of people. It's a chronic relapsing disorder. And when you put it in that kind of framework, the frustration and the decrease in quality of life that happens with it is more apparent. And these patients, they don't understand why the pigmentation is happening, and they need a lot of counseling and emotional support and reassurance, as well as clear expectations. So expectations on timelines, and usually I'd like to tell most of my melasma patients to try their treatment plan for 3 months before we change course, and to have expected and realistic goals. And just talking about compliance and consistency. And I think there's a question in a chat. Is it how many days before treatments that they would need electrolysis and laser? I actually personally think, based on what this formulation contains, that you don't need to stop it before, and that you can probably start it like a couple of days after your procedure, depending on what you're trying to achieve. Like,
I agree.
It's not, mm-hmm.
I agree with you.
Mm-hmm. And I think that also helps to enhance the results.
And prevent PIH.
Mm-hmm. And I think a lot of our melasma patients have given up by the time they've seen us. Like, they're looking for that. They've given up looking for that miracle cure. They're still looking for it, but they're frustrated, and they need someone to listen to them. A lot of it is listening to their story, finding out what they've tried. There is a real fear of hydroquinone. It's been banned in certain countries, and a lot of people don't want to use it, whether it's because of that fear or because they've used it in the past and developed irritation. And I think there's a lot of really elegant ways to do things now. So we don't need to use ingredients that may not be beneficial for the long-term health of our skin. So I think educating patients about how we can help target the different components, and I just phrase it to them like, we can target the pigmentation, we can improve the reactive oxygen species, we can target those inflammatory pathways and those vascular pathways. So they understand there's different layers that you need to target, and it's a cycle, right? We need to talk about what you do at home, what you can do in office, and how we combine all those treatments to give you the best possible results. So limiting triggers with UV avoidance, sun protection, limiting those triggering factors, hormonal medications, things like that. Reducing the pigment production with cosmeceuticals, and removing the pigment with adapted in-office procedures and these cosmeceuticals is kind of that cycle that melasma patients need support with. And I think education and empathy is a great way to form a partnership with your melasma patients that will give them those sustained results and clearance that they're looking for. Thank you. So sunscreen challenges. Yes, patients need a lot of education about sun protection. I won't do laser treatments on patients who are not wearing sunscreen. So those sun protection habits, avoiding the sun, peak hours of the sun, finding something that they actually like to use, right? If you can have a great product, but if the patients won't use it, then it's useless. And how to apply your sunscreen. So for full face application, quarter size amount, 2 finger lengths amount, and apply 15 minutes before exposure and reapply when outdoors. And then the importance of making your cosmetic treatment a ritual. Self-care, that's important. Taking time for yourself, taking time to treat yourself. It shows that you care about yourself and prioritizing your health and your skin quality. And, some of the pigment doesn't go away all the time. And having guidance about what products you can use to help control that even while you're in the process of healing, is good information for patients too. And I think that's where things come into play, and what can really set you apart as a provider. So there's aesthetic medicine, there's cosmeceuticals, but they really go hand in hand. And patients today want to come to you and experience that 360 approach and be able to not just get a treatment from you, but get the homework too, so they can feel supported in their journey and you can meet all their needs for their skin condition. So again, just taking home those points are that personalized skin diagnosis, understanding the patient's history, taking the time to find out what are they doing now and what's not going right and how we can tweak this and improve this for their individual needs, their skin type, their budget, their other coexisting concerns. And then educating a little bit in just simple terms, like we've gone through many points on the pathogenesis and where those active ingredients are targeting. You find that the buy-in from your patients is a lot higher, and they're going to do that personalization in that pre-procedure phase, so their outcomes are going to be better. And then post-procedure, we want to focus on healing the skin if there was anything that caused irritation or anything ablative, and we want to maintain the results we achieved. So if we can simplify that for our patients and give them something that they can use pre and post-procedure, our patients are going to get better outcomes. They're going to keep coming back to see us because they're going to be so happy. There's a question in the chat.
Any yes, we will go back. Yeah.
Okay.
Yeah, you can go ahead. Go ahead, Renita.
Yeah, like any contraindications during pregnancy? I don't think so from that ingredient profile. Those are all ingredients I'm comfortable with my patients using when they're pregnant. And, I'm not comfortable with them using hydroquinone and retinoids during pregnancy. So then, and in pregnancy, we don't usually offer procedures in office either, right? So it's nice that they can have something effective to use.
The only thing that we've seen, and Alphascience even says it, but I was not always agreeing, is because of the smell. They say, oh, maybe the smell is going to be amplified for a pregnant woman, but it's the only thing. But at the end of the day, they're really happy, like you just said, to find a solution that they can actually, that is not toxic for them. And it really works during pregnancy.
And any other contraindications? I don't think so.
No, there aren't.
Yeah. And then how long? I think this is something that patients should continue to use. It's like melasma is a chronic condition, and this is their supportive care. This is their skincare routine. Do you offer training, Linda?
Of course. Yes, we do. Yes, we do have a training. We have an academy that can support you throughout the whole process, and not just only when you open an account, but throughout the time that you're going to be using the product in combination with different technologies and may have questions. And you also, both of you are part of the ecosystem. So if they have any questions, we can always reach out to you.
Yeah, I think I was excited to do this webinar because melasma is one of the most challenging conditions that we treat as dermatologists. It requires a lot of hand-holding and a lot of education. So anything that we can do to simplify that process with actually quite a simple regimen and give our patients the results they want is really going to improve their buy-in and compliance with the treatment plan that we're offering for them. And it's important to know about, different ingredients now that we are able to target the different mechanisms of action of melasma to give patients the best results.
Perfect. There's other questions.
Should we just finish the last key takeaways and then start answering the questions?
Yeah. So I think I went through
everything.
I think so.
We can go back, remove the presentation, and then go back. Thank you. Yes, to the questions for each person. Would you like to continue with the questions, Renita, or?
Sure, I can do that. Has anyone used this on the body or only the face? Interesting.
Gigi.
Yeah, I have the experience on using it on patient that has melasma on their face. They can have melasma on their arms. So yes, I have tried it and it works beautifully again. So you can use it also.
A lot of people had asked us, Gladys, about under armpits or inner thighs, those areas. Has it been, in your experience, tested?
No, no, I think that we have to think about that are these areas are very sensitive and maybe they're not like suitable to put in that areas. I don't have the experience, but we should try. But just with caution because it's an area that it's very sensitive, armpits, the bikini area, but maybe another formulation that works with these areas, it's better, but let's try.
We have,
And
yeah.
is
So,
Alphascience in the chat?
yeah, we're doing the questions from the
No, but
chat.
I'm sorry, I'm in Paris.
Oh, yes, I think Cécile is with us right now.
If Cécile maybe has experience with this, she could share, because we do
Yes,
have a lot of
Cécile is
questions
with us.
regarding the underpits.
Let me see real quick.
Or maybe she's sleeping at this time.
No, she just texted me. She
Which is
is with
normal.
us. She's right here.
Okay.
Cécile Shrimpton. If we can maybe unmute her, please, CBAM.
I'm here.
Oh,
Cecile.
Hello. I didn't see you.
Cécile, you're here? No, it was Gladys who said I'm here. Anyway, we continue with the questions until Cécile is able to connect, if ever.
No, she is here. She's in the chat. She's texting us in the chat.
Okay, so tu peux continuer à poser les questions.
Yes, so somebody said, what can we suggest as in clinic treatment for people of color?
Oh, one thing is that Melabrite is very suitable for all phototypes. So you can use it in every phototype without risk of hyperpigmentating more, or it's very safe. It's very safe. We here in Mexico have a lot of phototypes 4 to 5, and I use them in my patients, and there's no problem. You always have to do the SPF, of course, and it's like doing in any other phototype.
Sharon said, what about maintenance and exposure to sun, especially when traveling? Some patients are encouraged to stop using to avoid sun exposure, and then the patients come back with darker melasma and they're so upset.
Yeah, of course. Someone with melasma, it's not going to be encouraged to have sun exposure without sunscreen. But the ingredient itself, the cysteamine or Melabrite, the product itself, it's not going to give you more photosensible skin. So you don't have to worry about it. You most worry more because of the sunscreen protection your patient should have during these days, that it's going to be suitable for water resistant and everything we want to, but you don't have to stop the treatment even.
So Jessie says how many days they need to stop before electrolysis and laser.
None.
Yeah, we answered those ones already.
Okay, and we did the pregnancy. How long can we recommend this to our patients?
We already went through this.
Yeah, we did this one. What does training with you look like?
Pardon me?
What does training with you look like?
The training.
Yes.
Caroline, are you on the call?
Yes, I am.
Okay, so maybe we can go through this very quickly. How does it look through the academy?
Of course. So training is always included with your opening order of Alphascience. We have our training online that is available 24/7 for all about the fundamentals. We're going into every product details, recommendation, beauty routine. So you really have an ongoing access to all the training content that is regularly updated with any new products or any new protocols. Besides that, we do also have coaching sessions provided for you and your team. So not just the people that might recommend Alphascience in clinic, but also everyone who's in contact with clients, so they know about the brand, they know about the positioning, and how to combine it with every in-clinic services. So we have regular coaching sessions that can be virtual or even in clinics as well.
Thank you.
And another question very similar to the laser one is how many days do they need to stop before microneedling and chemical peels?
They don't.
So same answer. And I think I haven't missed anything. Yeah. If anybody else has a question before we talk about the next steps. Oh, can we get the recording of the webinar? Yes, so that's part of the next steps right after the webinar.
Yeah.
So you will receive not only the recording that's going to be shared with you, but also a link to book a private session. You'll have a 20-minute complimentary session with one of our specialists to analyze your needs and to be able to see if it's the right fit and how you can take it the next step with us and benefit from the training. You also can open an account with us. So what happens with the account is you're able to do it online as well. We have a special offer for the webinar that's only going to be available for 1 month. It's something that we've never done before. So it's very exciting to see how it's going to be received. I will put everything in the chat for you right now, but you will get everything by email. You'll get everything. Just to make sure that you don't miss any update, please subscribe on the link for our newsletter. And I will re-put the link right now in the chat for you.
Thank you, Anya. Well, I think this closes the webinar, the meeting altogether. Yes, or we have something else, Rania?
I'm just gonna add now in the chat if they can wait for a second so they can receive everything in the chat.
Yes, and I wanted to thank you very, very much, Renita, Gladys, for your time, generosity, knowledge. It's really inspiring to hear you both and for sharing your experience with us.
Thank you.
Thank you.
Perfect. So are we
to open
good?
an account, here's the link in the chat. You'll have access to the brochure as well. And following right now is a link.
Who?
Following right now is a link to book a 20-minute session with us.
Mohsen, are you in the call? Are you in the meeting still? Maybe he stepped out. All right. Perfect. Well, thank you, everyone. Thank you so much for your time, and you have a wonderful evening.